Hello guys, welcome back to my YouTube channel. My name is Divya. I am CPC certified medical coder. So today we'll continue the musculoskeletal system, and our today topic is bunion and the hammertoe correction. Okay, so let's start, guys. So okay, so first of all, let understand that what a bunion is. So a bunion is an condition. It is a bony bump that develops at the base of the big toe due to the misalignment of the joint, and it can lead to the pain, swelling and difficulty in the walking. Okay. So here you can see in the pic that here is an metatarsal. There is an foot, there is an 5 metatarsal. There is an first metatarsal. In the first metatarsal, that bone moves outward. The big toe drift inward towards the other toes. Okay, inward toward the other toes, and it becomes prominent and forms an bone bump on the inner side of the foot. That is known as bunion. Okay, here is a normal foot, and here it is an bunion condition foot. Bunion is also known as hallus valgus. So next. So it is an pick of the foot. You should have to know that before we move to next topic. Okay. So here is an here is an metatarsal bones, 5 metatarsal, first metatarsal, second metatarsal, third, fourth and fifth metatarsal. Okay. So here is an this one. What is this? This one is an metatarso phalangeal joint. Okay, metatarso phalangeal joint, because here is a metatarsal and here is in phalanges. That connecting joint, that is known as metatarso phalangeal joint. So there is 5 metatarso phalangeal joint. Here is an distal distal interphalangeal joint. Here is an in the phalanges. Here these are the phalanges. Okay, in the toe there is an distal proximal phalanges and the distal phalanges. There is no middle phalanges, but in the rest of the toes there are the middle phalanges also. Proximal phalanges, proximal phalanges, proximal and the distal and the middle phalanges. Okay, here is an talus calcaneal bone. These are the tarsals bone. Okay, so next. So first, what are the types of bunion? So in the bunion, there are 3 types. That is an hallus valgus, that is an lateral deviation of the great toe, which is most common. Okay, and the second, that is hallus rigidus. Rigidus, that is an arthritis of the first metatarsophalangeal joint. Toe becomes stiff and it is not deviated so much. So here is in stiffness. The stiffness is known of the first metatarsophalangeal joint is known as the hallus rigidus, and the if the lateral deviation bony bump will be there, that is known as the hallus valgus. And the third one is that is an Taylor's bunion that occurs at the fifth metatarsal, that is an little toe side. Okay. So hallus valgus, true bunion, that is a lateral deviation. Hallus rigidus, that is an stiffness of the first metatarsal joint, metatarsophalangeal joint, and the Taylor's bunion, that is also known as bunionate, which occurs at the fifth metatarsal, that is an little toe side. Okay, next. So why bunion happens? As we previously said that bunion happens due to the tight wearing soles, genetic predisposition, and some arthritis. Okay, if the imbalance of the tendons, then pulls toe laterally, and the joint instability, bony overgrowth. Okay. What will physician do if the conservative treatment or the conservative management has been failed? Then the physician will do the surgical treatment. So the physician will first he will do the bone cut. That is an osteotomy. Cutting in the bone is known as osteotomy. The second, He may also done some joint fusion. Okay, that is known as arthrodesis. The third, he may also do the joint replacement. That is an arthroplasty and the excision of the bunion. Okay, next. So these were the ICD code condition. That is an Hallux valgus right to M20 series. Okay, Taylor's bunion M20.2. Okay, so these are the ICD conditions. We'll see in the while we do the operative reports and while we do the navigation. We'll see all these. So these were the procedures of the bunion. Okay, bunionectomy. That is an Hallux valgus correction. So Hallux valgus correction, that is an lateral deviation of the first metatarsal. That is a bunionectomy. So if there is an bony bump, then what will physician do? He will remove that bony bump. So these were the related codes. 28292, that is an correction of the Hallux valgus with bunionectomy, with sesamoidectomy when performed with resection of proximal phalanx. 28295, that is an with proximal metatarsal osteotomy. 28296 with distal metatarsal osteotomy, 28297 with first metatarsal and medial cuneiform joint arthrodesis, 28298 with proximal phalanx osteotomy, 28299 with double osteotomy. So these were the CPT codes. I will show you in the details because here this one is very much uh, complex complex procedure. So we'll see one by one these CPT codes. So first code, that is an 28292. What is an definition? What is an description of this code? So it is an correction of the Hallux valgus with bunionectomy with sesamoidectomy. That is a small bone below the first metatarsophalangeal joint. Okay, as I saw that what is sesamoid bone here in the first. This one is the sesamoid bone in the first metatarsal. Okay. So with sesamoidectomy, when performed with the resection of the proximal phalanx. Okay. Proximal phalanx base when performed or any method, or this procedure is also known as Keller's bunionectomy, McBride procedures, or Mayo procedures. Sometimes in the procedures, these are not written. Simply they write like Mayo procedure, McBride procedures. Okay, Keller's bunionectomy. Next. So here is an pic. First, before moving all these, we have to know that the structures. Okay, here's an foot structure. Here's an first metatarsal of the big toe. Okay, first metatarsal. So in the first metatarsal, here is an base. Okay, middle one is body, and this one is head, which is connected to the phalanges. Okay, the metatarsal bone, which is connected to the phalanges, that is proximal phalanges, and that head is that area near that is known as head. Okay. So these are the distal phalanges. As I previously said, these are the middle phalanges. These are the proximal phalanges. Okay. There will be a sesamoid bones in the first metatarsal. You can see that there will be a lateral and the medial sesamoid bone. Okay. These were the cuneiform bones. That is lateral cuneiform bones, intermediate, and the medial. And these are this one is the navicular. This one is cuboid, and here is in talus, is in calcaneus. These are metatarsal bones. So these are the bones bones of the foot. Okay. So in the 28292, what will physician do? That is an Hallux valgus correction. So physician first he will do what? Incision and exposure of the joint, so that he will remove the bony bump. So first, physician will make a medial incision over the first metatarsal bone. Here, first metatarsal bone. After that, he will remove the medial eminence. So what is medial eminence? So the in the first medial eminence is the first metatarsal head. Okay, that bunion bump is known as the medial eminence. So he will remove the bunion bump. Okay, he will save that bunion bump. That is known as exostectomy. Exostectomy. And the third procedure, that is after exostectomy, he will do the resection arthroplasty. That the surgeon will remove the base of the proximal phalanx. Base of the proximal phalanx. So where is proximal phalanx? This one is proximal phalanx. So it will base. Here is an base. Base of the proximal phalanx. He will remove that. Okay. After that, he will create a space in the joint and helps to reduce the pain. And after that, he will do the soft tissue balancing. Okay. And after that, the close are done. Okay. First incision and exposure of the metatarsophalangeal joint so that he will remove that bony bump. He will identify that and medial eminence that will he will save that area. Okay. That is exostectomy. And after saving, what he will do? He will do the medial eminence remove and smoother the contour restore. And what he will do that? Surgeon will remove the base of the proximal phalanx. So the main part is that bunion bump remove, bunion bump save. Okay. And after that, the base of the proximal phalanx will be removed. Base. Here is an proximal phalanx. Here is an phalanx, and this one is proximal phalanx, and here is an base. So he will remove the base of the proximal phalanx. Okay. Base of the proximal phalanx. So that one, so hallux valgus correction with proximal phalanx base resection. Okay. So next, we'll see one OP report example. Okay. Let's see one OP report. So what is preoperative diagnosis is hallux valgus deformity right foot, and same post-operative also. And procedure performed is correction of the hallux valgus with resection of the proximal phalanx base, that is Keller procedure, right foot. Anesthesia given, local and regional. What is the operative technique? So the patient was first placed in supine position, and right foot was prepped and wrapped in the sterile fashion, and the medial incision was made over the first metatarsophalangeal joint. Okay. And after that, a dissection was carried out down to the procedure to expose the joint capsule. And after the capsule was inside, the medial eminence was identified and the base of the proximal phalanx was resected. So what? Base of the proximal phalanx has been resected. To correct the deformity, soft tissue balancing performed to reline the grade 2, and the wound was irrigated and closed in layers, and dressing was applied. So we'll navigate this procedure. So first diagnosis is hallux valgus deformity. Deformity of the hallux valgus of the foot valgus, right. Valgus. Okay, this one. Here is an hallux. Okay, right side. M20.11 is an ICD for hallux valgus of the right foot. Now we'll proceed the procedure. So what the procedure is? Hallux valgus correction with resection of the proximal phalanx. Okay. So first correction of hallux valgus. Hallis valgus correction. 28292. So this one is the code. Okay. Correction of the hallux valgus with the bunionectomy, with the sesamoidectomy when performed, with the resection of proximal phalanx base. Now, right side of the foot. So, as we know that here is an hallux valgus of the first metatarsal phalangeal joint and it is on right side. So, we'll give the modifier right side. Okay. Now, coming to next, that is an 28295. Okay. Okay. So 28295, that is an hallux valgus correction with osteotomy at the base proximal of first metatarsal or the base osteotomy. Okay. Here is an base osteotomy. Cut in the base of the metatarsal. Okay. So first he will what to do, physician will make an similarly that make an incision over the first metatarsal and expose the bone and joint. Okay. After that he will do the bunion removal. He will do the removes the bunion bump or remove or save the bunion bump. That is medial eminence. After that, that is the main step, that is an proximal metatarsal osteotomy. Surgeon will make an cut into the base. Here is an base of the metatarsal, first metatarsal. It may be the crescent type wedge or cut can be an oblique. Okay. And after that, he will realignment. He will do the realignment of the metatarsal bone and shifted into the correct position. And after that, the fixation of the bone has been applied, stabilized using and screws, sometimes using in screws, pins and plate. And after that, he will do the soft tissue balancing and closure of the wound and dressing will be applied. So here is in before what the foot looks like and after the procedure done, what it's look like. Okay. So next, you can see that simply that is, he will just make an incision. Okay. Identify the bone and joint. After that, the resection of the medial eminence, that is bony bump removal or the save. And he will make an cut into an base of the first proximal metatarsal. After that, realignment and the fixation has been done using and screws, pins, and soft tissue balancing has been done and the closure of the skin or the wound. Okay. So we'll see one OP report for the this procedure 28295. That is an so what the procedure same hallux valgus deformity and the procedure performed hallux valgus correction with proximal metatarsal osteotomy, anesthesia given, that is an general anesthesia, and operative report will see that. So the patient was placed in supine position and the left foot was prepped and wrapped in sterile fashion. And the medial incision, first criteria, first key point, medial incision was made over the which area? First metatarsophalangeal joint. After that, the dissection was carried down to expose the joint capsule, which was incised. Okay. After that, the medial eminence was resected and a proximal osteotomy of the first metatarsal for further alignment and correction. And the first metatarsal head was repositioned and the fixation was achieved using screws and pin. And the soft tissue balances were performed for the proper alignment of the great toe and the wound was irrigated and closed in layer and dressing was applied. We'll see the navigation of this. That is an hallux valgus. Left foot, deformity, same. Valgus, hallux, left side, na? Left side, not this to code mode. So M2012 simply right left side, and for the right 1 1. Okay. So here is an hallux valgus correction with proximal metatarsal osteotomy. Okay. So correction of hallux valgus with osteotomy. Okay. First metatarsal, proximal metatarsal osteotomy. Okay. Unilateral, no modifier, 28295. Okay. So it's navigation of the 28295, and we'll give the modifier left side. Okay. Left side. So as we know that the hallux valgus is in for the great toe. So why we not give the toe modifier? Toe modifier T1, T8 to T9. Okay. So based on the client specification, we'll give the TA modifier. But simply for the understanding, we have to give the RT or LT. Okay. So next we'll come to next to 8296. Okay. 8296. Okay. So what is 282? What is the description of the 28296? That is in correction of the hallux valgus with distal metatarsal osteotomy. Okay. Distal means here is an head, or we can say that, or sometimes it is called as the Austin or distal osteotomy or the severon. Okay. Here is an metatarsal, first metatarsal, and here is an head, that is an distal side. Okay, here is an base, middle, and the distal side, that is an head side. So the bunion correction with the distal metatarsal osteotomy. We'll see the procedures. So what will physician do? He will simply that incise that the area given at the joint of the great toe, and bunion removal, that is medial eminence has been removed or saved, or the V saved, you can see here V saved osteotomy at the head of the first metatarsal or V-shaped cut has been made, and the realignment has been done. So the metatarsal head shifted laterally and straight to the toe, and fixation has been done using screws or pin, and the closure has been done. So main part is V-shaped cut osteotomy has been done at the first metatarsal head of the first metatarsal or V-shaped cut. Okay. You can see here, first incision and exposure of the joint, medial eminence removal or saved, osteotomy V-shaped at the distal, or we can say that head of the first metatarsal, and after that the realignment has been done, fixation using and screws, final alignment done, and the closure has been done. Okay, so this one is 28296. So distal metatarsal osteotomy. Here is an OP report. Simply hallux valgus deformity right foot, and the procedure performed hallux valgus correction with distal metatarsal osteotomy, severan or Austin procedure sometimes said that, and anesthesia is local or regional. So what operative written? So the patient was placed in spine position, and the right foot was prepped and wrapped in sterile fashion, and the medial incision was made over the first metatarsophalangeal joint. So first what we have to see that where which type of incision has been done or not. So here medial incision done. First criteria. Over which area, which location? First metatarsophalangeal joint. After that, the dissection carried out to expose the joint and which was inside. And the third criteria, the medial eminence bunion was resected. Fourth, which at where, that is a distal osteotomy of the first metatarsal has been done. Okay, and the metatarsal head was shifted laterally to the correct the deformity, and fixation was achieved with using screws or pins. Soft tissue balancing performed to alignment of the great toe, and the wound was irrigated and dressing was applied. Okay, so simply we have to see the criteria. Medial first incision, where first metatarsophalangeal, what has been done? medial eminence resected. After that, we have to see that the proximal, distal, or another, which side has been, which is performed. Okay, we'll see in the navigation. Okay, Hallis valgus right foot, as we see that M2012. So we'll navigate for the Hallis valgus correction of Hallis valgus. Okay. After that, the osteotomy has been done. So which side? Distal metatarsal. Okay. So metatarsal will choose that. Distal metatarsal. For the proximal, for the double osteotomy, we'll see that in the, so here is an double distal metatarsal. Okay. No. So then 28296 comes. Okay. So it is a navigation of the 28296, that is an, we can say that the Severon-Austin procedure. Okay. So let's start 28297. Okay. So in the 28297, what do we see? So in the 28297, that is a correction of Hallis valgus bunion with the fifth metatarsal, that is a cuneiform joint arthrodesis or the fusion. Okay, that is a fusion, or the, we can say that the lapidus procedures. Okay, fifth metatarsal. So here is a metatarsal, and here this one is fifth metatarsal. Okay, and here is a cuneiform bone. You can see that. Okay, and these were the cuneiform bones, lateral, intermediate, and medial. Okay, and the fusion has been done. Okay, so first, what will physician do? Physician will make an incision over the midfoot, expose the first metatarsophalangeal joint, and the between the first metatarsal and the medial cuneiform. So here is an cuneiform bones. These were the cuneiform bones. Okay, here's in first metatarsal. Okay, first metatarsal with the so the joint arthrodesis has been done. Okay, with the first metatarsal and the cuneiform bones. First metatarsal and the cuneiform bones. Okay, so we'll make the incision over the midfoot, expose the first metatarsophalangeal joint between the first metatarsal and the cuneiform bones, and the joint preparation has been done. So main thing is that now, if a joint preparation has been done, it means that the surgeon will remove the cartilage from the both the surface of and for the fusion purpose. So why joint preparation done? For the fusion purpose. That is a key point. After that, the correction has been done, and the first metatarsal is repositioned into the alignment and the reduce the deformity and corrects the intermetatarsal angle. And the arthrodesis has been done. Surgeon will fuse the first metatarsal with the medial cuneiform. Okay, and screws has been inserted, and the bunion removal or the medial eminence also saved or removed, and the soft tissue balancing for the alignment and the closure has been done. So here you can see that first incision has been done. First, here is an bunion medial eminence. Okay, so expose the bunion removal after the joint preparation of the both the joint, that is an metatarsal and the cuneiform bones. After that, he will prepare the joint for the fusion purpose. After that, the fixation has been done using an screws and plate. So these were the 28297. Okay. So we'll see one OP report for this hallux valgus deformity right foot, that is on severe. Okay, and procedure performed, that is hallux valgus correction with first metatarsal osteotomy and the fusion of the first tarsometatarsal joint, that is lapidus procedure right foot. Anesthesia, regional anesthesia, and the operative technique, that is an patient was placed in supine position. and the right foot was prepped and wrapped in the sterile fashion. And the first criteria, we'll see a medial incision made over the where. Second criteria, that is where, that is in first metatarsophalangeal joint and extended proximally towards the first tarsometatarsal joint. And the third criteria, that is medial eminence was resected. It means bunion has been resected. And the first metatarsal osteotomy was performed to correct the alignment. Attention was directed to first tarsometatarsal joint and the cartilage was removed. And the fourth criteria, that is an joint surface was prepared. And this word is where we see that it means there will be done for the fusion. The joint surface prepared for the fusion purpose. Okay. And the first tarsometatarsal joint was fused, that is Laplace procedure, and was stabilized using screws and plate. And the first metatarsal was properly aligned with the medial cuneiform. Okay. So the first metatarsal properly aligned with the medial cuneiform and restoring the normal anatomy. Soft tissue balancing done, and the wound was irrigated and dressing was applied. So we will see the navigation of this one. Okay. So Hallis valgus deformity for the right foot, this one. Okay. So correction of the Hallis valgus. Hallis valgus. Here's an arthrodesis. So simply, what is arthrodesis? Fusion of the joint. Arthrodesis with the medial cuneiform. Okay. Unilateral. No bone graft. So this one is 28297. So simply, this is a navigation for the Hallis valgus correction bunionectomy arthrodesis. That is, so 28297 modifier RT. Okay. Next we will see the 28298. Okay. 28298. This one. So what is 28298? Correction of the Hallis valgus with proximal phalanx osteotomy, or we can say that the Akin type of procedure. So the Hallis correction with the proximal osteotomy, proximal phalanx. So this one is the phalanx of the great toe. This one is a proximal phalanx, and there is an proximal phalanx osteotomy. Okay. So Hallis valgus correction with the proximal phalanx osteotomy and the Akin type of procedure. Okay. So what will physician do? First, he will simply do in the all procedure like similarly, he will make an incision over the first metatarsophalangeal joint. After the medial eminence, bony bump has been removed or saved, and the soft tissue correction has been done. Okay. And the fourth one, that is an osteotomy, that is perform Akin osteotomy cut in the proximal phalanx. This one is proximal phalanx. He will make a cut in the proximal phalanx to realign the properly, and fixation has been done using screws or pins to stabilize the osteotomy, and closure and the suture of the incision has been done. Okay, you can see that. That is an Hallis valgus deformity. Okay, medial bony bump has been there. So what physician will do? Some incision has been done over the first metatarsophalangeal joint. After that, the proximal phalanx has been cut. Okay, proximal phalanx of the proximal phalanx has been cut. That is Akin osteotomy, and the realignment has been done using screws and pins, and the closure has been done. Okay. So one procedure OP report. I am showing that the OP report because to understand in a simple way. Okay. So here is an Hallis valgus deformity right foot. Procedure performed Hallis valgus correction with proximal phalanx osteotomy. That is Akin procedure. Right foot. And anesthesia, local or regional anesthesia. Operative report what say? Let's start. So the physician was placed in supine position and the right foot was prepped and wrapped in sterile fashion. And the first criteria, that is medial incision over the great toe. Okay. After that, the dissection was carried down to expose the proximal phalanx, and the medial closing wedge osteotomy, Akin osteotomy of the proximal phalanx was performed to correct the angular deformity, and the osteotomy was carefully closed to realign the toe, and they fixed using small screw or the staples, and soft tissue balancing performed, and wound was irrigated, closed in layer, and dressing was applied. So we'll see the navigation of this procedure. Okay, simply same ICD for the Hallux valgus right foot. Okay, so we'll see the only what the procedure performed: Hallux valgus correction, proximal phalanx osteotomy. Okay, so correction of the Hallux valgus osteotomy with the phalanx. That is an wedging of the phalanx. Okay, so this one is the navigation of the 2828. Okay, simple. Okay, so next we'll see the navigation. We'll see the what the 28299 is. Okay, every time it comes like that. Hmm. Okay. So Hallux valgus correction with double osteotomy. So 28299. What is the description? Hallux valgus correction with double osteotomy. That is an first metatarsal osteotomy combines with the Akin osteotomy or the proximal phalanx. That is 28296 and 28298. Okay, so here is a double osteotomy. Double cut has been made. Okay, so first in the Hallux valgus correction with double osteotomy, physician will what do? Incision, simply first incision over the first metatarsophalangeal joint, expose the bone joints and capsule over the surrounding tissue, and bunion excision, that is removal of the medial bony bump, bony prominences. After that, the simply soft tissue balancing done. The main procedure, that is double osteotomy, that is two separate bone has been cut. Two separate bone has been cut. First osteotomy at the metatarsal, that is first metatarsal bone, and the second osteotomy at the phalanx, that is skin type of procedure. Okay, and after that the fixation has been done using and screws or plates, and closure has been done. It means the double osteotomy means double cut has been done. First osteotomy in the metatarsal, and the second cut in the second osteotomy, that is phalanx. Okay, simple. So this one you can see here, first incision and exposure of the bone and joint or capsule, we can see that, and bunion excision, that is bony prominences has been removed or saved. Soft tissue balancing has been done. First osteotomy has been done at the metatarsal, and the second osteotomy done at the proximal phalanx, and the fixation has been done using screws and plates, or the closure has been done, that is 28299. Okay, we'll see one OP report for that. Okay, so here is in Hallux valgus deformity right foot, and the post-operative same procedure perform correction of the Hallux valgus with proximal and the distal first metatarsal osteotomy. It means the proximal osteotomy and the distal first metatarsal osteotomy right foot. It means there will be two cut, proximal osteotomy and the distal. That is a double osteotomy. Okay, anesthesia here. So what were the key points? We'll see that. The patient was placed in supine position and the right foot was prepped and wrapped, and the medial incision. First criteria, medial incision was made. Which area? At the first metatarsophalangeal joint. And the dissection was carried down to the capsule was inside. And the second criteria, medial eminence was resected. And then now the third, that is a distal osteotomy of the first metatarsal was performed to correct the alignment. And additionally, a proximal osteotomy of the first metatarsal was carried out for further correction of the deformity. And both osteotomy, here both osteotomy site were stabilized using screws and pin, and soft tissue balancing was performed to maintain the alignment. So first key point is medial incision at the over the first metatarsal, and the distal osteotomy of the first metatarsal performed, Additionally, a proximal osteotomy of the first metatarsal also performed, and both the osteotomy was stabilized using screws and pins. And soft tissue balancing was performed to maintain the proper alignment. And the wound was irrigated and closed in layer, and dressing was applied. So we'll see the navigation of the double osteotomy. Okay. So Hallux valgus deformity, same ICD code M20. Hallux valgus, right foot, that is M2011. So we'll see the navigation of the double osteotomy, Hallux valgus correction. Correction of Hallux valgus, Hallux valgus correction, osteotomy, other unspecified, metatarsal. Here is a double osteotomy. So double osteotomy done. No modifier will give 28299. So here is a double osteotomy. Okay, we'll give the modifier as given. That is a right. Okay, simply it is a navigation part. Simply I shown the navigation part. So now let's start with another topic, that is an Hallux rigidus. Okay, Hallux rigidus procedure. Hallux rigidus procedures. Okay, so Hallux rigidus. What Hallux rigidus is? Stiffness in the first metatarsophalangeal joint. Okay, so CPT codes were 28289, that is Hallux rigidus correction chelectomy procedure, also known as, and the second, that is 28291 Callis types resection. Here is a screenshot of the CPT codes. Okay, 282 Hallux rigidus correction with chelectomy, debridement, and capsular release of the first metatarsophalangeal joint without implant, and this one is with the implant. So simple. This one is for without implant. This one is with implant. Okay. So here is this one is a chelectomy. This one is Keller types. Next. 28289, that is an Hallux rigidus correction with chelectomy, extra chelectomy. So what is chelectomy? Extra bony growth removal. Okay, and the debridement and the capsular release of the first metatarsophalangeal joint without implant. So what capsule is? Why it need to be released? So capsule is a simple fibrous. Here is an example of the, I have taken the knee example. Okay, so the capsule is a joint capsule is an fibrous connective tissue envelope that surrounds the synovial joint. So here is a synovial fluid between the two two bones. Okay, so in the synovial fluid there is a layer, that is synovial layer, and outside that layer there is a fibrous layer that is known as the joint capsule. Okay, that provide the stability and the enclosing the synovial fluid. If there so this one synovial fluid. If there is a thickness in that capsule, then that capsule should be removed. Okay, removed or released, to release that capsule. So first in that procedure 28289, what will physician do? Physician will do an incision over the first metatarsophalangeal joint, that is an incision over the big toe, and after that the joint has been exposed. Okay, so that he will reach the joint capsule. And the chelectomy. Chelectomy is an bony growth has been removed. Bony spurs. Okay, that is osteophytes removed. And the debridement, that is cleaning of the joint, has been done and removes the damaged or cartilage to lose the fragment and debris, and capsular release to loosen the tight capsule. Okay, and after that the closure has been provided. Here is a chelectomy procedure. Okay, incision has been done to expose the joint, and chelectomy, bony spurs has been removed. After that the cleaning of the joint and capsular release has been done. Okay, so it will increase the range of motion, and the closure and the incision close with the sutures. So simply this one is. So here is an OP report for the 28289. That is an hallux rigidus. First metatarsophalangeal joint. Diagnosis is hallux rigidus. And the procedure is colectomy of the first metatarsophalangeal joint, right foot, and anesthesia. So operative technique, that is the patient was placed in supine position and the right foot was prepped and wrapped, and the dorsal incision. First criteria, incision has been made over the first metatarsophalangeal joint, and after that the dissection was carried out to expose the joint capsule, and the capsule was incised. It means capsule release procedure has been performed, and the prominent osteophytes has been identified, and the dorsal aspect of first metatarsal head and the base of the proximal phalanx, and the colectomy was performed, and the removal of the dorsal osteophyte and a portion of metatarsal head for to improve the joint motion, and the joint was irrigated and improved the range of motion was confirmed, and the wound was closed in layer and dressing was applied. So we will see the navigation of the colectomy procedure. So first ICD, that is an hallux rigidus. Okay, hallux rigidus. Then specified right side. It was right side. Okay, it was right side. So M2021 is an ICD for the hallux rigidus, and the procedure performed is colectomy. That is the bony colectomy of the first metatarsophalangeal joint. Colectomy of the joint. Um, Hallux rigidus correction. It was an without implant. Okay, unilateral. No. So 28289 is an without implant hallux rigidus correction with colectomy, debridement and capsular release of the first metatarsophalangeal joint without implant. And as per the documentation, we'll give the right RT modifier. Okay. And second one, that is 2828991, that is uh, with we'll see same procedure with that is an colectomy of the joint hallux rigidus. It was with implant. If there will be implant given, then that procedure will be 28291. Simple. In the 28291, simple incision has been done, that there will be difference is only implant placement. So say simply here is in the OP report also you can see that first incision was made over the first MTP joint and the dissection carried out to, and the after that the joint surface and the osteophyte was identified. Base of the proximal phalanx was prepared for the implantation, and the joint implant was inserted into the first MTP joint. So here is a simple differences. Implant has been inserted. So the procedure will be 28291 with the RT modifier. So next we'll see the Taylor's Bunion. We'll see the Taylor's Bunion procedures. Okay. Taylor's Bunion. So Taylor's Bunion is also known as bunionite. It is an bony prominences of the fifth toe. Okay. So the CPT will be the 28110 28308. That is an ostectomy, partial excision, fifth metatarsal head, bunionectomy, separate procedure. And the 28308 is an osteotomy with or without lengthening, shortening, or angular correction, and the metatarsal other than first metatarsal. Okay, so here is you can see in the CPT codes in of the screenshot of the CPT book also. Okay, next. In the code 28110, what will physician do? Physician will make an incision, okay, or the fifth metatarsal. Here is in fifth metatarsal head, okay, of the little toe. Little toe, fifth metatarsal head region, okay. Here is in base, middle, and the head region. After that, the exposure of the soft tissue has been dissected so that the metatarsal bone has been exposed. After the exposure of the bone, the physician will excise that bony prominences or benign lesion. Okay, if there is some lesions has been there, cyst has been there, then physician will excise that bony prominences, or he may use some instrument like the burr saw, and the bone is reshaped and smooth so that, and the irrigation area of has been cleaned and remove the debris, and closure has been performed and dressing has been applied. So simple. So here is an OP report of the Bunion procedure. Okay, 2821110. So diagnosis is exostosis of the proximal phalanx right great toe. Post-operative diagnosis, procedure performed partial excision ostectomy of the proximal phalanx, right great toe, anesthesia, local anesthesia. So operative report is the patient was placed in supine position and the right foot was prepped and wrapped in sterile fashion, and the small incision was made over the affected area of the great toe, and the dissection was carried down to expose the proximal phalanx, and the prominent bony exostosis was identified. Using appropriate instrument, a partial excision of the bone was performed to remove the bony prominences and relieve the symptom. And the bone edges were smooth, and the wound was irrigated and closing layer sterile dressing was applied. So we'll see the navigation of this procedure. Okay, ICD exostosis of the proximal phalanx. Exostosis. This one is wrong. We'll not take that. We'll navigate by disorder. Disorder of no, this one is not. Disorder of balance. No. Airway, heart, infectious, organ, proximal phalanx, toe, time out. It's coming like that only. Wait. 189, 8 exam. 189, This specified disorder of bone ankle. Okay, it's in bone, na? Okay, disorder, disorder of bone. Others, other specified bacteria. Okay, so here you can see that one is navigation of the other specified disorder of the bone, ankle, and foot. Disorder, other specified, spell on the bone. Okay, so this one is the ICD. Now CPT, that is an partial excision of the ostectomy of the proximal phalanx, okay, of the great toe. Okay, we'll see the navigation, exostectomy of the bone. Which bone is there? Proximal phalanx. Reason, don't remove the proximal phalanx. Metatarsal. Proximal phalanx. Reason. Wait, 2 Bunion will navigate with Bunionette procedure, bunionectomy excision. Simply, will not navigate with this. Only Bunionette procedure, excision. Okay. So 28110. Okay. So here is a separate procedure of the fifth metatarsal head, and here is in great toe. We'll see the fifth toe. Okay. So we'll give the modifier fifth toe, that is T6. So modifier T6. Okay, T6. Give that. Now coming to next, that is 28308. 28308. So we have seen the Bunionette procedure 28110, and now we'll see the second, that is the 28308. So in the 28308, what is 2? Here is in surgeon will make an incision over the affected metatarsal bone, usually second toe to fifth toe. Okay. So the soft tissue were carefully separated to expose the metatarsal bones, and after that the physician will make an cut to the bone and realign the bone. After that he may shorten or lengthen, or after that correct the deformity like the hammer toe, and the bone was repositioned and the closer, and if required the fixation may be given like screws or pins or plate, and incision has been closed, suture has been done, and the dressing were applied simply. So in a OP report, here here is an preoperative diagnosis, that is Taylor's bunion deformity, right fifth metatarsal, and the post-operative same and procedure performed osteotomy of the fifth metatarsal, bunionetic correction, and the right foot anesthesia. The patient was placed in supine position and the right foot was prepped and wrapped in sterile fashion, and the lateral incision was made over the fifth metatarsal head, and the dissection was carried down to expose the bone, and the prominent lateral eminence was identified, and the osteotomy of the fifth metatarsal was performed to correct the deformity, that is bunionette, and the metatarsal head was repositioned and the medially, and the fixation was carried out with the using of the screw pin, and the surgical site was irrigated and proper alignment was confirmed, and the wound was closed in layers and the dressing was applied. So we'll see the navigation of the this procedure. Okay. So first ICD, that is an deformity of the Taylor's bunion. Deformity. Taylor. Uh, Navigate by Taylor's bunion. Mhm. Taylor's right side, not this to code more. So M21, 621. Okay, so navigate by bunion. So next, what is the operative report? That is an osteotomy of the fifth metatarsal, bunionetic correction. So we'll see the navigation by osteotomy. Osteotomy. Limb or the lengthening, we take that, and after that, what the metatarsal, that is an metatarsal other than the first metatarsal. It is an fifth, but other than the fifth. Okay, other than the first. No devices has been used. Just to 28308. Okay, so this one is the procedure. Navigation of the 28308 procedure. Okay, coming to next. 28308 we have done. Okay, so 28308. So in these two CPT code, the 28110 is simply excision, and there will be no simply excision of bone and no alignment has been done. And in the 28308, there will be a cut into a bone and alignment also done. Main difference. In the 28110, excision but not alignment. Here is an done cut into the bone and realignment has been done. So the main question is, sometimes I see that can we code these both procedures? Sometimes we can code and sometimes we not, based on the documentation. For the different site and the different bone, code both together. Okay, if the site is different, bone is different, then we can code these two procedure along with this. Okay, but for the same bone and same site, if these two procedure is done, it means only we'll give the more appropriate code, that is 28308. Okay, simple. Now the next topic, that is bunion arthrodesis for the correction of the bunion. So physician will do make incision over the joint and makes and cartilage, removes the cartilage of the joint surface, aligns the toe in the proper position and fixes the bone using screws and pins and allows the bone to fuse permanently. So the movement will not turn. So why arthrodesis is done? Simply it is a fusion of the two bones. Two bones has been fused so that the pain will not occur. Okay, in order to relieve the pain. the bunion arthrodesis has been done. So it is in 3 CPT code, that is 28740, 28750 and 28755. So what these two bones has been fused? In the 28740, the first metatarsal and the medial cuneiform has been done, fused, fusion at the tarsometatarsal joint. Okay, so arthrodesis, metatarsal or tarsometatarsal single joint. Okay, so here which joint has been fused? Metatarsal and the cuneiform joint. Okay, and the second, that is 28750 arthrodesis, grade 2 metatarsophalangeal joint. So here the first metatarsal and the phalanx joint has been fused together. In the 28755, that is an a proximal phalanx and the distal phalanx. Here is an proximal phalanx and distal phalanx has been fused together. Okay. So we'll see the one OP report for this. The arthritis of the tarsometatarsal joint, right foot, diagnosis, and the procedure performed arthrodesis, that is fusion of tarsometatarsal joint, right foot, and the operative technique, that is an patient was placed in the supine position and the right foot was prepped and wrapped in sterile fashion, and the dorsal incision was made over the tarsometatarsal joint and dissection carried out to expose the joint. An articular cartilage was removed from the both joint surface to prepare for fusion. Okay, and the joint surface was aligned and internal fixation was performed using screws and plate to stabilize the joint. Fluoroscopy was performed and the wound was irrigated, closed in layer, and sterile dressing was applied. We'll see the navigation of this procedure. So here is an arthritis of the tarsometatarsal joint. Arthritis of the tarsometatarsal joint. From 19071. Okay. Now, second, that is arthrodesis has been done of the TMT joint. Okay. Procedure arthro arthrodesis of the tarsometatarsal single joint. Okay. Now graph. So 28740 arthrodesis metatarsal single joint. What if there will be something another, that is an navicular cuneiform bone? Okay. 28737 multiple or transverse, what it so something different code. Okay. Tarsometatarsal, if there is an metatarsophalangeal, grade 2. 28750. Okay. So simply we can navigate like this only. Okay. So tarsometatarsal here, metatarsal, no bone graft. So this one is the code for that procedure. Okay. And we'll give the RT modifier. Now the next topic we'll see the hammer toe. Okay. So the last topic of the today's session, that is the hammer toe. So what is hammer toe? Hammer toe is simply a condition or a deformity, we can say that, of the one or more toes, usually second and third and the fourth, and it become bent at the middle joint, that is the PIP joint, and resembling just like a hammer. Okay. So how it's occur? What is the causes? The causes is same like the that is an Hallus valgus, that is bunion, that is in tight shoes, muscle imbalance, or the trauma or arthritis. Symptoms may be the corn callus, difficulty in wearing shoes, and toe deformity, bent shape. Here you can see the second, third, and the fourth. Here is a bent in the middle joint. Okay, proximal interphalangeal joint. Okay. So simply we can say that the hammertoe correction, so there will be a correction will be done to treat that deformity. Okay. Now, why procedure is done? If the conservative treatment fails, surgery has been performed, and in the procedures in the hammer toe, physician will do arthroplasty, that is removal of the proximal phalanx, and sometimes the arthrodesis, tendon transfer, or tendon repositioning, or the soft tissue release has been done, and the K-wire fixation temporary to hold toe straight. Okay. The second, what a physician will do. Physician will simply incise over the affected toe, whatever the toe has been affected, he will incise that to expose the joint. So after exposing the joint, he will release the tight tendon, removes arthroplasty done or the fusion has been done. And after that, the insertion of the K wire, okay, if needed, and close and season with suture and the applied dressing. ICD code M2040 series, okay, and the CPT code for the hammertoe will be 28285, correction of the hammertoe interphalangeal joint, and the 28270 capsulotomy, tendon lengthening, tendon transfer. Simply this hammertoe correction 28285 includes these all three procedures, that is capsulotomy, tendon lengthening, and tendon transfer. But can be coded along with this hammertoe correction interphalangeal joint. These procedure also we can code, but only sometime if there will be a different incision. But if there will be a same condition, same location, and if the location is same and the same incision has been there, then it will be not coded along with this, but different we can code along with modifier. You'll see that here is an capsulotomy, metatarsophalangeal joint, interphalangeal joint, correction of the hammer toe, partial or total phalangoectomy. Here is a single toe 28232. Okay. So in the 28285, he will make an incision, removes the part of the bone, fuse the joint, and may insert the pins or to straighten the toe, and coding criteria is, as we previously discussed, that code 28285 that involves the PIP joint correction, deformity correction documented. Do not code separately if there will be a tendon release capsulotomy K wire. Code only if there will be a different toe, different site and unit, and code as per the toes. Example, 2 toes 28285 into 2. Okay. We'll see with the one example, that is here is an preoperative diagnosis is hammer toe deformity, second toe, okay, second toe right foot, and the post-operative same procedure performed, correction of hammer toe of the second toe right foot, and the indication of the surgery, the patient presented with the painful deformity of the second toe of the right foot consistent with the hammer toe procedure. The patient was brought in the operating room, placed in supine position. After that, the anesthesia given, and the here the first criteria, a longitudinal dorsal incision made over the which area, proximal interphalangeal joint of the second toe, and the dissection was carried out through the subcutaneous tissue, protect neurovascular structure, and the extensor tendon identified split longitudinally to the head of the proximal phalanx was resected using the surgical saw and consisted with the arthroplasty technique, and the joint surface was prepped and the toe was brought into the proper alignment, and the K wires was inserted across the joint to maintain the alignment and stabilization of the toe. The surgical site was irrigated with the normal saline, and the extensor tendon was repaired, and the skin was closed with the sutures, and the dressing was applied, and the toe was placed in correct position. So you see the navigation of this procedure. Okay. So first we'll see the hammer toe deformity ICD CPT ICD code. Hammer toe right foot. So M24 one is an ICD for the hammer toe of the right foot. The procedure is the hammer toe correction. Okay. We'll see the correction of hammer toe fusion. Okay. So 28285 of the second toe. So second toe of the right foot. Second toe of the right foot. So T right foot second digit T6. T6 modifier. We'll see that. So here is an T6 modifier. Okay. So this one is the example of the hammer toe correction. Okay. One more example. We'll see that here is an one OP report. Mixed procedure will be there. There is a correction of the hammer toe, second and third toe. Okay. And here OP report, what is given? That is the patient placed in supine position, right foot was draped and wrapped, local anesthesia, dorsal longitudinal incision made over the PIP joint of the second and third toes of the right foot, and the extensor tendon resection of has been done, and arthroplasty has been done, and toes when aligned, correct the position using K wires with the toes, and sterile dressing was applied. Okay. So here is an second and third toe. So here is an ICD CPT code will be same multiple times. That is T2 to okay, right side. T6 and T7. Okay. Because the right side second toe T6 T7. Okay. So same multiple times will code the correction of the hammer toe deformity. Okay. Next OP, that is an hammertoe deformity, right and second toe with the MTP joint contracture. Okay. And the procedure performed hammertoe correction with the PIP joint arthroplasty and MTP joint capsulotomy, right second toe. And indication, that is patient present with painful hammertoe associated with the MTP joint contracture causing the difficulty in the ablation, conservative treatment paid. And the procedure performed, the patient was placed in supine position. The right foot was draped and wrapped in sterile fashion, and the local anesthesia was administered, and the dorsal incision was made over the PIP of the second toe, and the extensor tendon was identified, and the resection of the head and the arthroplasty performed, and the toe was partially, and the, due to the persistent contracture at the MTP joint, a separate dorsal incision. Here is a separate over the MTP joint, capsulotomy was performed to release the joint contracture, and the toe was aligned properly, stabilized using K wire, and the irrigated and the suture and dressing was applied. You'll see the navigation of this one. Okay. So hammertoe deformity, same ICD M2041. So we'll see the ICD code for the CPT code for this one procedure. So 28285. Okay. Capsulotomy. Metatarsophalangeal joint 1. So this one is the CPT code for capsulotomy. And this procedure was performed along with this procedure. Why? Because there is a separate incision. Okay, separate incision. We will give the modifier T2. Okay, T2. Move that T2. Modifier move. Okay, we'll give the T2 modifier, and here again T2 modifier with 59 modifier. Okay, so give like that. Okay, so right foot, second toe, K6. Okay, so we'll give if the separate incision, but if there will be a no separate incision, then what? Then we'll give that procedure only, because this procedure includes capsulotomy also. Okay, but here is a separate incision, na? That's why we give the capsulotomy code along with this Hammertoe codes. Okay. So now next procedure, that is an preoperative diagnosis: hallux valgus, bunion, right hammertoe deformity, second toe, left foot, and the procedure performed bunion correction with distal metatarsal osteotomy and the right foot, and the hammertoe correction, second toe foot. Okay. Indication was same: bunion deformity on the right foot and hammertoe correction on the left second toe. So procedure: the patient was placed in supine and both feet were prepped and wrapped in the sterile fashion. The right foot bunion correction with medial incision was made over the first metatarsophalangeal joint, and the soft tissue was dissected carefully, and the medial eminence was resected, and the distal osteotomy of the first metatarsal was performed, and the metatarsal head was shifted laterally and fixed with a screw, and the proper alignment was confirmed, and the left foot hammer-toe correction, second toe, attention was directed to the second left toe, and the dorsal incision made over the proximal IP joint, and the extensor tendon was incised, and resection of the head of the proximal phalanx performed. Toe was straightened and using K-wire, and tendon was repaired. All wound for irrigated. Hemostasis achieved, and incision closed, and dressing was applied to both the feet, and the procedure tolerated by the patient, and recovery in the stable condition. So we see the navigation of this procedure. Okay, so physician what has done? Physician has done the bunion correction with distal metatarsal osteotomy, and the second hammer-toe correction. Okay, of which foot? Second toe, left foot, and one that is right foot. So first we'll give the ICD for the hallux valgus and the hammer-toe. So hallux valgus already we have given M2012, and hallux correction. That is an hammertoe deformity. Hammertoe deformity also there. Okay, hammertoe deformity. So we'll navigate the OP. Okay, so correction of the hallux valgus, osteotomy, metatarsal. So here is in distal metatarsal. Okay, distal metatarsal. So here is in distal metatarsal, unilateral, no. So here is in 28296. Okay, and the next one, that is an hammertoe correction. Hammertoe correction. Simple. Okay, and we give the modifier for the bunion correction, that is in bunion correction right side. Okay, and for the hammertoe correction, left foot. Okay, left foot. but we can give the toe modifier as per the documentation and as per the client. If client specification is saying that give the T modifier, toe modifier, then we'll use the T5 and T7. Otherwise, we'll give the RT or LT. So guys, we have completed our Bunion and Hammertoe topic. Okay. So in the next session, we'll see these two procedure, tenotomy, topaz tenons. Okay. So that's it guys for the today. Okay.